The House GOP has unveiled a sweeping plan to reshape Medicaid, the nation's largest health insurance program. This ambitious proposal seeks to curb federal spending, devolve power to states, and fundamentally alter how millions of Americans access healthcare. The plan has ignited a fierce debate, pitting those who see it as a necessary fiscal correction against those who decry it as a heartless attack on the vulnerable. At the heart of this plan lies a fundamental shift in the relationship between the federal government and states in managing Medicaid. The GOP proposes to replace the current open-ended funding system with a fixed block grant, giving states greater autonomy but also exposing them to greater financial risk. This shift has raised concerns about potential cuts to benefits and eligibility, leaving many to wonder if the safety net Medicaid provides will be weakened. The GOP's plan is not merely about dollars and cents, it reflects a distinct ideological vision for social programs. Embedded within the legislation are provisions targeting specific healthcare providers and services, particularly those related to reproductive health and gender identity. These measures have further inflamed the debate, transforming it into a battleground for broader cultural and social values. As this contentious proposal makes its way through Congress, the stakes are high. Millions of Americans, from low-income families to individuals with disabilities, rely on Medicaid for their healthcare needs. The outcome of this legislative battle will have profound implications for their lives and the future of American healthcare. One of the most significant changes introduced by the GOP plan is the implementation of work requirements for certain Medicaid beneficiaries. Able-bodied adults aged 19 to 64 without dependents would be required to engage in work or community service for at least 80 hours per month to maintain their coverage. This provision, a cornerstone of conservative efforts to reform social programs, is touted as a way to promote personal responsibility and reduce dependency on government assistance. Proponents of work requirements argue that they encourage self-sufficiency and can help individuals transition to private insurance through employment. They point to anecdotal evidence suggesting that such requirements can motivate individuals to seek out job opportunities and improve their economic prospects. However, critics argue that these requirements create unnecessary bureaucratic hurdles and can actually hinder employment by making it harder for individuals to afford transportation, childcare, and other necessities. In addition to work requirements, the GOP plan introduces new cost-sharing measures for Medicaid beneficiaries. Under the proposed changes, individuals would be required to contribute a portion of their income towards their healthcare costs, capped at 5%. This provision is intended to incentivize responsible healthcare utilization and reduce unnecessary spending. However, critics argue that even modest cost sharing can create significant barriers to care, particularly for low-income individuals who already struggle to make ends meet. Studies have shown that cost sharing can lead to delayed or foregone care, potentially resulting in more serious health problems and higher costs in the long run. The impact of these cost-sharing measures on access to preventative care and chronic disease management is a major concern for healthcare advocates. A critical element of the GOP's Medicaid plan is the proposed freeze on state provider taxes. Currently, states utilize these taxes, levied on hospitals and other healthcare providers, to generate a significant portion of their Medicaid funding. Freezing these taxes at their current rates, as the GOP proposes, would severely limit states' ability to raise revenue for their Medicaid programs. This provision has sparked widespread concern among state officials, who argue that it would create a substantial funding gap and force them to make difficult choices. With their hands tied on provider taxes, states would be left with limited options: cut benefits, reduce eligibility, or divert funds from other essential services like education and infrastructure. The National Conference of State Legislatures, a bipartisan organization representing state lawmakers, has expressed strong opposition to the provider tax freeze, warning that it would have devastating consequences for state budgets and the millions of Americans who rely on Medicaid. The organization estimates that the freeze could result in a collective loss of billions of dollars in federal funding for states. The potential impact of the GOP's Medicaid plan on healthcare coverage has been a focal point of debate. The nonpartisan Congressional Budget Office, tasked with providing budgetary and economic analyses to Congress, estimates that the proposed changes would result in a significant reduction in Medicaid enrollment. According to the CBO's projections, over 8.6 million people could lose their Medicaid coverage over the next decade if the GOP plan is enacted. This estimate takes into account the combined impact of various provisions, including work requirements, cost-sharing, and changes to state financing. The CBO's findings have fueled concerns that the plan would leave millions of vulnerable Americans without access to affordable health care. Those most at risk of losing coverage include low-income adults who gained coverage under the Affordable Care Act's Medicaid expansion, individuals with disabilities, and children from low-income families. The CBO's projections have been met with alarm by healthcare advocates who warn that the plan would reverse years of progress in expanding coverage and reducing the number of uninsured Americans. Section 5. Social fault lines, Planned Parenthood and gender-affirming care. Beyond its impact on Medicaid's structure and financing, the GOP plan has drawn intense scrutiny for its provisions targeting specific healthcare providers and services. These measures, often framed as cost-saving measures, have ignited a firestorm of controversy due to their implications for reproductive rights and transgender healthcare. One of the most contentious aspects of the plan is its defunding of Planned Parenthood. The legislation prohibits federal Medicaid reimbursements to Planned Parenthood clinics, effectively barring low-income individuals from accessing a wide range of healthcare services, including cancer screenings, contraception, and testing for sexually transmitted infections. This provision has been met with fierce opposition from reproductive rights advocates who argue that it would disproportionately harm low-income women and erode access to essential healthcare services. They point out that Planned Parenthood plays a vital role in providing care to underserved communities, and that defunding the organization would have far-reaching consequences for women's health. Section 6. A House divided, political battle lines drawn. The GOP's Medicaid plan has cleaved the political landscape, drawing sharp battle lines between Republicans and Democrats. The plan, a cornerstone of the Republican agenda to reduce federal spending and reshape social programs, has garnered near unanimous support from GOP lawmakers who view it as a necessary step towards fiscal responsibility. Republican proponents of the plan argue that it empowers states, promotes personal responsibility, and reduces wasteful spending. They contend that the current Medicaid system is unsustainable and that reforms are essential to ensure its long-term viability. Conservative lawmakers have hailed the plan as a victory for taxpayers and a step towards reducing the size and scope of government. However, the plan has been met with staunch opposition from Democrats, who view it as a heartless attack on the poor and vulnerable. Democratic lawmakers have denounced the plan's proposed cuts to Medicaid, arguing that they would have devastating consequences for millions of Americans who rely on the program for their health care. Section 7. Beyond Medicaid, a broader spending package. The GOP's Medicaid plan is not being considered in isolation. It is part of a broader spending package that aims to address a range of budgetary and policy priorities. This package, a testament to the Republican Party's commitment to fiscal conservatism, seeks to significantly reduce federal spending across a wide swath of government programs. In addition to Medicaid, the spending package targets other social safety net programs including food stamps and housing assistance. It also includes provisions aimed at rolling back environmental regulations, repealing key elements of the Affordable Care Act, and reducing funding for education and job training programs. The scope and ambition of this package reflect the Republican Party's determination to reshape the role of government and enact its conservative agenda. The spending package has been met with mixed reactions from economists and policy experts. Some argue that the proposed cuts are necessary to address the nation's growing deficit and debt, while others warn that they could have a negative impact on economic growth and exacerbate income inequality. The long-term consequences of this ambitious spending plan remain a subject of intense debate. Section 8. The clock is ticking. The debt ceiling deadline looms. The fate of the GOP's Medicaid plan and the broader spending package is inextricably linked to the looming debt ceiling deadline. The debt ceiling, a statutory limit on the amount of money the federal government can borrow, has become a recurring point of political contention in recent years. With the deadline fast approaching, the GOP is using the threat of a government shutdown or default to extract concessions from Democrats. They have made it clear that any increase to the debt ceiling must be accompanied by significant spending cuts, with Medicaid serving as a prime target. This high-stakes game of chicken has injected a sense of urgency and uncertainty into the legislative process. Democrats, while acknowledging the need to address the debt ceiling, have balked at the GOP's demands for deep cuts to social programs. They have accused Republicans of holding the economy hostage to advance their ideological agenda and have vowed to resist any attempts to gut Medicaid or other essential safety net programs. Section 9. Conclusion: a crossroads for American healthcare. The GOP's proposed Medicaid shakeup represents a pivotal moment for American healthcare. If enacted, the plan would usher in a new era for Medicaid, one characterized by reduced federal funding, greater state autonomy, and a heightened emphasis on personal responsibility. The consequences of these changes would be far-reaching, impacting millions of Americans who rely on Medicaid for their healthcare needs. As the legislative battle over Medicaid continues, the stakes are high. The outcome of this debate will determine the future of healthcare for millions and shape the social safety net for generations to come. The nation stands at a crossroads, facing a fundamental choice about the role of government in providing healthcare and the values that will guide American society in the years ahead.